the construction is probably affecting us about 25% is just my guess. Initially, I was pleasantly surprised. I said, you know, we're doing okay with this initial construction phase, because people would say, if it takes me an extra 5 or 10 minutes, I'm going to do that because I want to come in to see you. They hold us in that regard, which is a blessing. It makes my heart swell. It's really, really cool. Like, I use the example, if my wife, the lady who does her hair moves from one city to another city, she's going to drive to that other city to see that person because of the quality, and she likes that person and she'll go there. We see that a lot with our current patients doing the same thing. They're willing to drive an extra 5 or 10 minutes or go through this construction or the detours we have to get through this, and they're getting here. So.
Gar, co-owner of HealthQuest Physical Therapy and Medical Fitness, says early M24 construction didn't hinder business in the beginning, but that's changing.
The biggest difference where I think it's affecting us a little bit more now over the last 2 weeks is because since they really closed down M24 south of Drainer, now it's just one lane each way through Lake Orion, that's held some more people back from coming to us. When it was 2 lanes south of Drainer, we were doing fairly well. Now that they squeezed that down and they're doing all that, now that's something I really didn't expect, but we're seeing a little bit of a reduction. So what do? Instead of seeing a patient 3 days a week, we'll say, okay, Charlie, we're going to see you 2 days a week, but now it's super important for you to do your home exercises because you have to do your stuff at home. Coming in here 2 or 3 days a week is good, but what are you doing on the other 3 to 4 to 5 days? You have to do your stuff at home to get better.
Like many health businesses this year, their company has remained open for people who needed their services.
Once we found out that we were needed, we were able to stay open. We had one day where we shut down, we just reorganized. We had a full staff meeting, full team meeting, and unfortunately we had to put some people off on furlough and they went on to unemployment. We did keep a small percentage of our people here working. We spread out our tables, we reduced the number of patients we were seeing, reduced the number of people we were seeing in the clinic, and primarily we were just seeing those people who had surgery a while ago, our post-operative cases, because they were the ones who most needed physical therapy at that time. So that lasted about 2 weeks, and then after about 2 weeks we started getting phone calls from some of our patients who would say, hey Dan, I know I didn't have surgery on my neck, but man, my neck is killing me, can I come in? And we said, sure, Joe, you're welcome to come in. If you're safe coming in, we're safe having you. A lot of people were asking very important questions like, what are you doing? Are you wearing PPEs? Are you wearing masks? What are you doing? So I want to be sure. So I say, yeah, we're all wearing masks. We require all of our patients to wear masks. We're checking temperatures when they first come in. We're asking all the COVID questions. We've spread out our tables, and everything's going very, very well. We were cleared by OSHA. We were cleared by the Oakland County Sheriff, and we're doing pretty well with that regard. We also, at that time, we implemented telehealth. So I had more than a handful of patients I was seeing over the computer.
Staying open helped them stay afloat, but the pandemic still came with a cost.
We were down 70%, and we're starting to ramp back up now, so we're still down a pretty large percent, and we got some help through the government like most businesses were able to do, so that's helped a little bit. We're going to get through this. 2020, we're getting kind of punched in the face with the COVID. Now we're punched in the face with construction, although we knew this construction was coming. It's a challenging year for everybody here, but if you see the end of it, I think the end of this, the result of this is going to be very, very good. I know we're going to get through this pandemic. I know we're going to see an end to this construction, and then Oxford's going to be a place for people to want to come back in and visit, shop, stay, eat.
Gar says a part of making Oxford that desirable place is being understanding throughout the process to get there.
We ask our patients, if you're going to be late, please call us. And sometimes if someone is about 10 minutes after their appointment time and they're not here, we'll call them and say, hey Mark, is everything okay? We had you on for a 10 o'clock appointment, or oh yeah, I'm on my way, or sometimes they forget, and we're very able to reschedule their appointments to different times.
Construction is slowing down traffic both outside HealthQuest Physical Therapy and Fitness and in, but Gar says it's okay to call ahead and see how traffic is going.
Just letting them know when you're coming here, if you're coming from the north, it's a one-lane shot down M24, so please leave a little bit earlier. If you're coming from the south and coming north, the MDOT detour takes people, quite a ways around the building to the east. But there's also another detour we can have our few patients take if they go west. There's Glassby Side Street to the west where they can come out right by the Oxford Leader and get here in no time. And it's not a deterrent, it's not illegal, it's everything is good that they can go down that side street and get to us easier. We do have many more patients who come to us from the north and the northeast side of Oxford who come in. So they're getting here.
Gar says he wants residents to know that right now he is doing special offers.
We're also still promoting heavily our free consultations we do for patients. There's a number of people out there who are hurting or know somebody who's hurting, and they don't know what to do, who to see, how bad is my shoulder, how bad is my neck, my back, my leg pain. Well, what they can do is call us and schedule a free consultation appointment. And what that is about 15 or 20 minutes with a licensed physical therapist, and we do just a quick evaluation, and we get people out of that gray zone, this, not sure what to do, into a zone where, okay, now I know what's going on. Dan requested that I go see a specific doctor, and I can call the doctor, text the doctor, call the doctor's office, and do my best to get you in as quickly as possible so you're not waiting 2 months to see a doctor. It's nice to have some contacts like that. As if the doctor called me, we've had a couple of doctors that I know real well, they'll call me or text me, hey, I got a patient, just saw him today, I need this person in 48 hours. If it's a Saturday, a Sunday, a holiday, I make it happen. We come in and see them.
He's looking toward the future for business.
If we can rest on one specific thing, we always know in the year is in physical therapy, we always get busier from September through December. End of the year, people start thinking, okay, the kids are back to school, now moms and dads, aunts and uncles, grandmas and grandpas now can take care of those little aches and pains that they had all summer, but they had to watch kids. Now the kids are in school, if schools are open, and then they can come in and take care of what they have to get through. Also, at the end of the year, people's copays and deductibles are usually met, so then they go into having elective surgeries, whether it's a shoulder surgery, a knee scope, whatever they may need, and they need a little rehab after that. So our end of the year is always our busiest time of the year, and we're counting on that, just like I hope all the small businesses in Oxford are doing, because it's tough.
And the excitement includes fall sports.
We're really looking forward to a very successful full fall sports season at Oxford High School. We're very involved. We've been very involved, intimately involved with Oxford High School sports and the athletic trainers. I was over at the school today hanging out with the coaches of the football team. The cross country team was running around there. So I get there about 1 day a week in the summer, and then when school's back in, I go to the training room every Monday afternoon to offer another set of eyes and hands to Andrew and Alyssa, the two athletic trainers, just in case they have an athlete who needs a little extra help or another set of eyes and ears and hands on them to see what's going on. So hopefully we look forward to a really successful fall sports season. We can get back to normal over there with that.